Hello, I'm Dr. Joe Thompson, Surgeon General for the state of Arkansas. Thank you for joining me today to take a look at our vision for an improved Arkansas health system. Our U.S. healthcare system is undergoing dramatic changes driven by increasing needs, rising costs, more working Americans without health insurance, and a lack of coordination within the system. The most recent efforts to improve our healthcare system include passage of the Federal Patient Protection and Affordable Care Act in 2010. There's been a great deal of controversy around the Healthcare Act, and while it falls short in some areas, especially around cost control, it does provide opportunities that will benefit Arkansas more than other states due to the number of Arkansans who are in poor health, don't have health insurance, and have relatively low incomes. It's up to us as a state to proactively shape a better future for Arkansas's health system, taking advantage of what is provided by federal law and implementing meaningful changes of our own. The video you're about to see describes a future health system that may take some years for us to achieve, but there are many talented people across the state working now to help us get there. We've used the example of just one family to illustrate our vision, but want to be clear that the future health system we envision will provide the same convenient, coordinated, and high-quality health care to all Arkansans. Thank you for sharing it with me.
Rebecca Richardson and her family live in southeastern Arkansas. Her husband, Todd, is a fourth-generation farmer. Rebecca works as an administrative assistant at a small accounting firm. This morning, Rebecca woke up earlier than usual. As she went into the kitchen, she found that her mother, Verlene, who had come to live with them 2 years ago after Rebecca's father died, was already up and had started making breakfast. Rebecca was happy to see that Verlene was feeling energetic and that she had logged on to the laptop to make sure her morning weight, blood pressure, and blood sugar results had been received by the family's clinic. Verlene has diabetes and was recently diagnosed with congestive heart failure by the family's primary care physician, who had been able to consult with an affiliated cardiologist in Little Rock. The cardiologist could see the results of lab work and other tests done at the clinic and local hospital by accessing Verlene's electronic health record. This sure helped get Verlene's condition under control more quickly. The clinic is the family's medical home and provides them with 24-hour access to care 7 days a week. Following Verlene's diagnosis of congestive heart failure, a care coordinator sat down with Verlene to discuss her condition. He told Verlene that the team pharmacist checked each time a new drug was prescribed to avoid dangerous drug interactions. The care coordinator arranged a video conference with a nutritionist to help Verlene and Rebecca plan healthy meals. And he even sent a technician out to the farm to set up a weight scale, blood pressure monitor, and blood sugar tester that transmitted results directly to the clinic. The medical home nurse reviews the information Verlene sends each morning to monitor the effectiveness of her medications. Now, not many years ago, Verlene would have had to go to the cardiologist's office in Little Rock. Now, much of that interaction happened via email and phone. Rebecca knew that the nurse, the physician assistant, the cardiologist, pharmacist, and other team members all were able to see and add information to Verlene's electronic health record and to interact with Verlene and each other in real time, even when they were hundreds of miles apart. All of the monitoring, testing, preventive measures, and other care required to treat chronic conditions such as Verlene's diabetes and congestive heart failure are covered under a structured payment to the medical team. This enables efficiency, minimizes the risk of duplication of services, and ensures that care is coordinated in a way that reduces the potential of catastrophic incidents like a heart attack and an expensive extended hospital stay. Things are sure different now that the family has health insurance. Before he died, Rebecca's father was eligible for Medicare, but Verlene wasn't old enough to qualify. Because of her diabetes, they couldn't find insurance they could afford, so he kept working to keep his group insurance plan. After he died, Verlene couldn't afford to continue the insurance, so she put off going to the doctor. When the new insurance exchange became available, Verlene was able to easily compare options and found that she qualified for a tax credit that enabled her to afford a plan that provided the coverage she needed. It was a relief, too, that Rebecca was able to find a good insurance plan for her family on the exchange. The small accounting firm she worked for didn't offer health insurance, and with Todd being self-employed, they hadn't been able to find insurance they could afford and had done without. Fortunately, the kids had been covered by our kids, but every day had been a gamble, especially for Todd, given the risks of farming. While Verlene finished preparing the family's breakfast, Rebecca checked her email and noticed a message from the medical team's dental hygienist, reminding her that it was time for her kids to have their annual cleaning and checkup. The email contained several openings over the next months. She checked her calendar, clicked on some appointments that fit into the children's school schedule, and sent the email back. Since her family's computer was networked with the dentist office and school, as well as her medical home office, the appointments showed up on all of them simultaneously. The kids had received their flu shots and other immunizations, along with their annual body mass index, vision, and hearing screenings at school. The results were entered into each child's electronic health record that went straight to the clinic. Rebecca's youngest child, Bobby, has asthma. The school nurse is aware of his condition and has access to Bobby's electronic health record. She administers his rescue inhaler when he needs it and posts each incident, allowing the team at the family's medical home to monitor whether or not his asthma is being controlled. Another email was for Verlene and was password locked, so Rebecca could not open it. She suspected that it was from the team's mental health counselor. Rebecca had observed her mother to still be down after her husband's death and had encouraged her to discuss it with the physician assistant. Sometimes Verlene went to the counselor's office in person. Her office is in the medical home, which is less than 30 minutes away. She also has the option of talking with the counselor by video conference over the internet. As she stepped away from the computer, Todd waved at her through the window as he went to the barn. He had told Rebecca last night that he was going to do some preventive maintenance on the combine this morning. This kind of work could be dangerous. As a matter of fact, Todd's grandfather had been seriously injured working on a similar piece of machinery. Farming was still hazardous, but Rebecca took some comfort with the knowledge that today the medical home network included primary and specialty care and emergency transportation as part of a statewide trauma system, all parts communicated and coordinated in a way that was unheard of just a few years ago.